So, hi guys, I'm Emmanuel. I'm a GP, a salary GP in Lincolnshire, and I became a general practitioner in February this year. So, I'm newly qualified. I have a few videos on my channel where I talked about introduction to the 14 fish portfolio and how to do a clinical case review or a clinical case summary. I have some other, important information on my channel, on some of the videos that could help you successfully and more easily navigate your GP training. But in this particular video, I wish to just shed some light on case-based discussion, CBD. And this video is going to be particularly helpful for people who are just starting off or starting out, with their GP training, the ST ones, especially those who started in August last month. So CBD, case-based discussion, as the name it actually suggests, is a discussion you would have with a colleague, usually a senior colleague of yours. It could be a clinical supervisor, it could be an educational supervisor, or it could be anyone who is at a level of ST4 or and above. So most times, most of the middle grades, senior middle grades, registrars um, would actually be able to do CBDs, but it's usually preferred that you do the CBD with your educational supervisor or your clinical supervisor. Now, a case-based discussion is simply that modality of assessment of your training progress, where you have a discussion on a case, on a clinical case with these persons that I've talked about. It's usually supposed to be an interesting case. So it's not just any case, usually something that stands out, something that, you learned a lot, something that intrigued you. You found that maybe you learned how to, navigate the process of referring a patient, a stroke patient or suspected stroke patient, from primary care to secondary care, how to call the ambulance, how to do the handover, how to ensure that everything is done in a timely fashion. So you might want to use that kind of a case, or you went on a home visit and something quite drastic or dramatic happened. You had to call the ambulance, and and the patient was sent to hospital for treatment. Or it could be a mental health case. You learned something that broadened your understanding on how to diagnose and treat, certain mental health conditions. It could be menopause. It could be use of bisphosphonates in the treatment of, pathological fractures, for instance. So it could be anything, that you've actually learned something from. You can use for a case-based discussion. If I could go back in time to do my GP training again, there's something I would have really loved to include in my case-based discussion, which is actually what I want to tell you, and that is citation. So let's assume you've seen a patient with pathological fractures, fracture of the L1 vertebra, wrist fracture, something like that, you know what I mean? And you're thinking this patient will benefit from bisphosphonates. You will have to then decide you want oral bisphosphonates or intravenous bisphosphonates, and there'll be criteria for you to make that decision. But something that will make your case-based discussion even sweeter, more palatable, and would help you learn more and will help to imprint that knowledge in your memory even more is citation. So you can quickly go on the internet and do a quick Google search on journals or articles, journal articles that contain information on pathological fractures and the use of bisphosphonates. And we do a little bit of reading. You might not read the entire article. You might just read the abstract, and you can do your Control F and search through the article to see if there's any other important, facts that stands out. And then you could just say, okay, during your case-based discussion, you write it down and you share this with your supervisor that according to this particular study, they found this, they found that, they found that. So that will give more flesh to your case-based discussion and will really help you understand that particular case very well. Because whenever you do citations, whenever you bring research or citations into whatever you're doing, your clinical case-based discussions, your clinical case summaries. So you've seen the patient, you can quickly go online and do these article search and get some, a few information that you just use to to beef up your entries. Now, in terms of course, using information, citation is important or referencing. Most supervisors will not really tell you that you must put the references, to show exactly where you've extracted those information from or extracted those information. But I'll say it's good practice to put the link. So if you've got information from the NICE guideline or from the New England Journal of Medicine or from any other journal, you can just copy the URL, link, and just add it there so your supervisor can access that particular information. Or if you want, you can do a more detailed reference writing at the end. I believe most supervisors will not want you to really go into such detail. Just put the link so your supervisor can access that information, and also they'll learn from it, and that will demonstrate that you're also learning. So CBD is a very good thing. It's meant to be reflective. It's meant to be a combination of reflective learning and, of course, academic learning, which means you've seen a patient. What have you learned from that experience? How have you improved your knowledge in terms of going back to read? And how have you broadened, the scope of your understanding by then doing these little research from, journal articles? So it's just something I think I should share with you. Don't feel overwhelmed. If you're feeling overwhelmed, reach out to me, reach out to your supervisor, reach out to other colleagues, ask, how you can more easily, navigate through your training. Sometimes it could be intense, but I want you to know that it's doable. We've all done it. We're not superhuman. We are just ordinary people like yourselves. So don't feel overwhelmed. Whatever has a beginning will surely have an end. So, look at it from the brighter side. And I really want to wish you all the best as you carry on with your training. Cheers, guys.